luckily, Norah O'Donnell of MSNBC had Howard Dean on to talk about it. First clip, we're going to see Judd Gregg, and he's going to, the Republican senator from New Hampshire is going to throw out one of those red herrings, and then Howard Dean is going to bat it down. So let's go to clip number 4 here.
Here's what New Hampshire Senator Judd Gregg told me just this morning.
You don't need a public option at all. In fact, a public option is simply a stalking horse for a single-payer plan, a system like they have in Canada or England, where the government basically manages all of health care, and you end up with rationing and delays, and as Senator McConnell said, you end up with a bureaucrat between you and your doctor.
Dr. Howard Dean is a former chairman of the DNC and former governor of Vermont. Chairman, governor, doctor, thanks for joining us. Good to have you here.
Thanks for having me on, Nora.
Let me ask you to address Senator Gregg's criticism. Is a public option a stalking horse for just government control?
Well, we've got to ask the Republicans to get the politics out of this and get down to work. Right now, there is a bureaucrat between you and your doctor, and it's a private health insurance bureaucrat. And what we want to do is give the American people a choice. Why the Republicans are always against letting people choose for themselves, I don't know. But give the American people a choice. Let them choose a public health insurance option, or let them continue in their private sector insurance. But the private sector hasn't treated people very well, and I think we need a public health insurance option for people to choose between.
I mean, how sensible is it? When he frames it like that, you're like, oh, well, why wouldn't I want another choice? Which is what I think. As a consumer, I think, all right, these private insurers cost a lot of money. If the government says they can do it cheaper, let me see what they got. Maybe their service isn't as good. But I'd like to see, and I'd like to see if they can do it cheaper. And it sounds very reasonable, does a great job here. He's going to keep going. O'Donnell's going to ask him, hey, aren't doctors against it? And Howard Dean's going to explain what the reality is.
Governor, you have the president going to address doctors, physicians at the American Medical Association, and they don't support this plan. Let me just read to you what the president of the AMA said. She said this, quote, we absolutely oppose government control of health care decisions or mandatory physician participation in any insurance plan. So if doctors don't support it, why would this plan work?
What you just said is the mistake. That's how the New York Times got themselves in trouble. I agree with what the AMA just said there. And I'm a big supporter of a public health insurance option. I think people ought to give a big choice. But, you know, we're not, that's exactly the point. We're not trying to tell doctors what to do. We're trying to get the insurance companies to stop telling doctors what to do and let doctors be free. And they are free under Medicare. You don't have bureaucrats telling you what you can and can't do under Medicare. But you do have bureaucrats in the private insurance industry doing that. So the Republicans have got to stop this stuff. We need to give, all we're trying to do is try to give the American people a choice between a system that is run by a fair intermediary, which is the government, to make sure that the insurance companies stop denying people coverage, stop taking insurance away when people get sick, and stop having bureaucrats tell the doctors what to do.
Yeah, look, again, fantastic job in explaining what it is. He said bureaucrats. I mean, he's going to get into this a little bit more later, I believe, but he's like, the bureaucrats are the guys in the private insurance. I mean, how many times have the doctors had trouble getting payment from the bureaucrats in the private insurance? How many times have you been denied coverage or because of the bureaucrats in the private insurance field? And he said, look, we're going to get a fair intermediary here who's not going to deny you coverage. And if it doesn't work, it doesn't work. It's a choice that you have. Now, as I look at Howard Stern, I'm sorry, that's a funny Freudian slip. Howard Dean doing a great job here. I think, why is this guy not the Health and Human Services Secretary, right? And then, second of all, I think, well, where the hell is the Health and Human Services Secretary? Where's Kathleen Sebelius? Why is she not on TV making these arguments? Why does Obama drop a 2-minute little segment in a speech at the AMA and not have all of his guys on TV forcefully arguing what Howard Dean is doing such a good job of arguing for, basically by himself, not supported by the government or anyone else? So here, let's go to clip number 3 here and have him finish up with Norah O'Donnell.
Governor, can you address the criticism that's been out there, though, that a government plan, why would we give, or a public option plan, would have the same kind of wasteful spending, et cetera, that Medicare and Medicaid have, and so why would we want to recreate and grow that?
Well, now, again, that somebody's making things up. In fact, the costs of running Medicare are much, much cheaper than the costs of running private health insurance. Medicare doesn't have to pay big salaries to the CEO. Medicare doesn't have to pay for advertising. Medicare doesn't have to give its big profits to investors. Because they're owned, but these are Wall Street publicly owned.
Yeah, but
companies.
doctors don't like it because they only get 80% of what they would under a private insurance
Yes, and
plan.
when we did something like this in Vermont, which resulted in every child in Vermont under the age of 18 had health insurance, having health insurance, we raised rates for primary care providers so that problem would be fixed. Look, I'm not trying to tell you that the government option is the perfect one. All I'm trying to tell you is let the American people choose for themselves, and you'll find the private insurers will behave much more fairly towards average consumers once they know there's going to be some place for consumers to go if they don't like their private insurance company.
And then finally, I do think this is a key point, Governor. If the average American has a choice then between this public or government option and their private insurer, how do you ensure that then employers don't drop coverage for some of their employees now that there's this safety net out there, which is a public option?
Well, the Obama bill says that it's pay or play, that if you do drop, then you've got to pay money into the fund. The other thing is this co-op thing, this is not a real compromise. This is a Senate problem. This is a fix for the Senate problem. It doesn't fix the American problem. I think the co-ops are a fine idea, but it won't work. And I love Kent Conrad. I think he's a great senator, but the co-ops...
He's a Democrat, too.
He's a Democrat. He's a wonderful human being, and I just hope he gets reelected forever because he's just a great guy. But he's wrong about this. The co-ops are too small to compete with the big private insurance companies. They will kill the co-ops simply by undercutting them, using their financial clout to do it. In the small states like mine and like Senator Conrad's, you're never going to get to the 500,000 number signed up in the co-op that you need for them to have any marketing. So this is a compromise that's designed to deal with problems in the Senate, but it doesn't deal with problems in America. And I think it's time for the Senate to stop playing politics, do what has to be done. If the Republicans don't want to get on board, and they certainly have never done, look, the Republicans all were against Medicare when we put that in. If the Republicans don't want to get on board, then we can do this without the Republicans. We have the votes to do a public health insurance option without a single Republican vote and without the one or two Democrats that have said no. And if that's what we have to do, we've got to do the right thing for the American people, not the political thing for the Senate.
God, I love this guy, man. It seems like he's the lone man out there fighting by himself as the Republicans throw talking point after talking point. Where the hell's the Obama administration? I know he spoke out on it yesterday. A little bit, but why aren't there guys on TV from the administration saying the same exact things Howard Dean is saying it forcefully until it gets beat into everybody's head? It's only a choice. You have more bureaucracy in the private insurance, and look at what he said there. Look, Medicare pays 80%, she said, to some providers. Well, then that means you're getting some sort of savings from that. And he said, no, in fact, we would raise the amount that the primary care providers are getting, because for those of you not in the medical field, the primary care providers are getting a lot less money usually than the specialists. And in fact, there's a huge imbalance there. And we might be much better off raising the salaries of some of the primary care providers. And if some of the specialists take a hit when they're making, some make $300,000-$400,000, some make $1 million a year, you know, sometimes just to take x-rays. Now, I don't want to diminish their work and what they've done to get there, etc., but if they take a little bit of a hit there so that we could all have a little lower rates and the primary care providers could have a little higher salary and we can get some sort of balance, I can live with that. But all of that will be worked out by the market because ultimately you have the choice. Why is Howard Dean the only one saying this?
Watch the live show at theyoungturks.com.